Good afternoon. I am Dr. Professor Vivek Gupta, interventional neuroradiologist. Today I am going to talk to you about brain stroke. So whenever we hear about stroke, we are not very sure what we are talking about. Is it paralysis? Is it becoming unconscious? Or what it is? So as per the medicine, acute stroke are of two types. One is ischemic, that means the blood supply of the brain gets cut off, and second is hemorrhagic, that means that there is bleeding inside the brain. So today I'm gonna speak to you about acute ischemic stroke, those type of strokes in which the brain's blood supply is cut off, and its advanced treatments. So whenever a stroke happens, what actually happens within our body is that a small clot, it starts from either the heart or the blood supply of the neck, and it goes inside the brain and blocks the blood flow to a portion of the brain. Whenever that happens, that portion of the brain which is not getting enough blood supply, which is getting starved of nutrients, it stops functioning temporarily. Whenever that happens, the patient or the person who's having the stroke, suddenly he becomes either unconscious, or his one side of the body becomes paralyzed, or his face becomes deviated to one side, or it becomes sloppy, or his voice is affected, or sometimes his vision is affected. When all of this or any of this symptom occur in a patient who was previously healthy, and these symptoms occur suddenly, then we say that that patient is having stroke and some part of the blood supply of the brain is cut off. So how common is it? You would be surprised to know, according to the literature, according to the World Health Organization, 1 in 6 people around the world will suffer stroke at any point of their life. So that means in a room filled with 10 people, maybe 1 people or maybe 2 people may have stroke during their lifetime. So this is a very high incidence, second only to cardiac emergencies and cancers. So when the disease is so common, we have to know what to do or what are the treatment options available to us whenever such a thing happens. So stroke has been treated traditionally by an injection called TPA for the last, I would say 30-40 years. That injection, how does it work? It is injected in our arm slowly over half an hour, and that injection dissolves the clot and the blood supply is restarted. But the problem occurs when the clot is big. So in those cases, this drug fails and patient is left with paralysis. For the last almost 20 years now, we have a new technique known as mechanical thrombectomy, through which we can deal with this stroke in a different manner. Imagine at your home, if your sink pipe or drain pipe is clogged, what would you do? You would do some kind of maneuver so that you can remove that blockage mechanically. So similar concept is there when our pipes or our blood supply pipe supplying the blood to our brain gets blocked. So we try to remove it mechanically instead of giving a medicine. How we do it? It's a very advanced procedure which is done through a very small hole in the wrist, in the upper part of close to our hand, or in the leg. Through that hole, which is around 2 millimeters, we go inside the brain. The operation is done under sophisticated machines known as cath labs. So under those machines we can see inside the brain and where our material or where our catheters are going. So we insert a very thin tube inside the brain and reach right at that point of the brain where the blood clot is sitting. Once we reach there, we confirm it on the images, and through with the help of a stent known as stent retriever, we catch hold of that clot and take it out from the body. It looks, when I'm speaking to you, it looks very simple, that you just go in and take it out, but actually what it is, that we can mechanically take out the clot which is causing blockage to the blood supply, and we can help in saving the brain. The injection treatment which I told you can be done only till 4.5 hours. After that, that drug is not so effective. However, mechanical thrombectomy, or the treatment with the help of stent, can be done very easily till 8 hours.